So calibration is important for a PFT machine because it's important to make sure that the machine is working properly and precisely. So this needs to be calibrated on a routine basis, and so basically the PFT machine measures a certain amount of air, and if it's like the known value, then we can assume that this measurement is accurate and that the machine is working properly. So patient values, they're based off age, height, sex, and race and ethnicity. And if we find these for our patients, then we can know the known values for everything in those categories, and then this will help us tell if our patient is within normal limits for their category or if they're not. So the horizontal bellow spirometer, so it's a vertical 7 to 8 liter cylinder, and it uses chymograph to record volume displacement. This is referred to as a wedge or bellows type, and it will not work if any particles or dirt get inside of it. So next is the water seal spirometer. So it's a counterweighted bell, so it's upside down or inverted into a water reservoir, and as the patient breathes, the bell or canister moves up and down, and then so when they're breathing in and out, the motion, it records the volumes with a pen or on the calibrated chart paper that's attached to the machine, which is what chymograph is. So the low friction water seal and counterweight, it limits the back pressure so that the measurement itself doesn't adversely affect the patient's results. And then the next thing is the Lilly type and the Feisch types for the pneumotachographs. And so the pneumotachographs, they measure flow according to the Venturi effect. And the Venturi effect is the phenomenon that occurs when a flowing fluid is forced through a really narrow section, resulting in pressure decrease and velocity increase, so which happens to the air as we breathe down through our airways. And so the Lilly type, it measures the difference in pressure over before and after a membrane with known resistance. So this measures the pressure drop when a patient blows into this device. And then the other type of pneumotachographs, if I'm saying that right, is the Fleisch type, and it uses a series of parallel capillaries. And this, the Fleisch is more reliable than the Lilly type. So similar to the Lilly device, this measures the pressure drop when a patient blows into the device, but a laminar flow is very important in order to obtain accurate and correct results. So the biggest advantage, like the reason why Feisch is preferred over the Lilly type, is because this method is very sensitive to the temperature, humidity, and atmospheric pressure surrounding the air. Therefore, both Fleisch and Lilly must be calibrated often, at least one day or after displacement or after use of each patient. And then, so the last one is I can't remember what it's called, the ultrasonic type pneumotachometer. So this uses ultrasound, and it's one of the latest developments. So these spirometers, they measure flow by determining the Doppler effects in the expired and inspired air using ultrasound. These spirometers require no calibration and do not need a thermostat, but not all studies are reliable. And lastly, the way that you perform an HBG is obviously you'd go into the room, introduce yourself to the patient, and then you'd make sure that you have the correct patient, and then you would explain the procedure to the patient. And so first I'd check the patient's wrists to see where they have the best pulse in your radial artery, which is the one on your thumb side. And then once you choose your arm, you perform an Allen's test where you occlude both your ulnar and your radial artery, and then you hold it down, and then you let go on the ulnar side, and then you should see the color rush back into your hand. So if that doesn't happen, then you probably shouldn't use that arm. You should try the other arm, because this assures that we have adequate collateral blood flow to the hand. So if anything happened to this artery while we were performing the ABG, then if something happened, then we would still have blood flow to the hand. So the next thing that you do is you'd get your supplies. So I'd want an alcohol swab to clean the site before I inject the needle, and then I would want tape, a cotton ball, and obviously the ABG needle. So first you'd feel for the patient's pulse, and then you'd insert the needle bevel up at a 45-degree angle until you see a flash of blood, and then you'd wait to collect your sample, and then you'd pull the needle out, cap the needle, and then after that's done, you want to hold the cotton ball or gauze or whatever you have on to the patient's puncture site for at least 10 minutes, because since we did puncture the artery, we want to make sure that there's no bleeding. So after you've held pressure, you want to look and then kind of wipe at the puncture site, and then if it still continues to bleed, then we still need to hold pressure until it stops bleeding.